Hello, my name is Denise Powell and I am Practice Principal at Millbank Medical Practice here in Bundaberg, and I'm also a Visiting Medical Officer at the Breast Screen Service, Wide Bay. My progress to being a GP was one of evolution, and one of the things that I had along the way were very good mentors. But the exciting changes in general practice with the development of the academic college and then the college continuing to then provide the fellowship examination made me realise that I'd like to contribute. I would like to have had that in existence when I was a young doctor. Of course, that wasn't to be, but I certainly wanted to make sure that I contributed to the development of general practice for the future. My experience with training registrars and the feedback I get from them is that they have great and vast experience with different types of patient care, that they talk to their city counterparts who don't have the same experience. And one, of course, this is satisfying. It's what you've trained for, and it's what you hopefully wanted to become a doctor to do, and that's to kind of use your academic training and in problem-based solutions for health and for treating disease. So they get a great variety. Now that great variety stands them in really good stead for all of their examinations. When it comes to the vivas, of the number of 14 or so cases that they're currently actually being examined right now, they will have seen them. They will have seen those cases time and time again. So it certainly is a great preparation for passing the fellowship, but more importantly than that, it is an opportunity to keep diverse and to grow through different areas of your practice as your life stages change. The benefits to working in regional communities are vast. There's everything that you're learning about either as a medical student or as a junior doctor. You can advance yourself in any area of practice in these communities, and you see such a wide variety of medical problems, and you see them in the context that these problems occur. If the community is disadvantaged, or if there's a significant occupational health hazard, you can see all of that working in the community. So I think it keeps you broad and helps you practice the full spectrum of medicine that you've been trained to do. Sitting underneath all of this at the values level, it is enormously satisfying to know that the training that you've had as a doctor, long as it is, has great worth in these communities that are actually short of medical professionals. What I value about living regionally, beside the fact that of course this is home and I feel a very strong sense of place, is that I can transition between work and my life outside of work, with my family and my friends and my hobbies very quickly, and sometimes that can also be more readily integrated. Currently my interest is in climate and growing things to try and improve climate. I have a small hobby farm, and I live on 15 acres outside of Bundaberg, and I can be at work in 10 minutes by car and 20 minutes by bicycle, and I can get home that quickly as well, and that means that I can spend so much extra time in my life outside my work.
To specialise as a general practitioner, there are several training pathways on offer to candidates. Firstly, candidates will need to apply for a training place to gain fellowship with their preferred college, which is either the Australian College of Rural and Remote Medicine, known as ACRRRM, or the Royal Australian College of General Practitioners, known as RACGP. The entry points to fellowship for both ACRRRM and RACGP include the Australian General Practice Training Program, the Remote Vocational Training Scheme, or for ACRRM, there is a third entry point, which is via the Independent Pathway. The training pathway for fellowship with the RACGP is 3 years full-time equivalent and consists of 12 months full-time hospital training, 18 months full-time general practice placements in an accredited general practice under an accredited supervisor, and 6 months full-time of extended skills training. For those interested, there is also an optional 4th year of advanced rural skills training, which leads to fellowship in advanced rural general practice, or the RACGP qualification. The training pathway for fellowship with ACRRM is 4 years full-time equivalent and consists of the core generalist training component, which is 36 months full-time and includes hospital time with a minimum of 10 weeks in obstetrics and gynecology, 10 weeks in paediatrics, and 10 weeks in anaesthesia. Community rotations, including 6 months primary care, 3 months secondary care, and 3 months emergency care, and rural and remote practice, which includes 12 months living and practicing in a rural or remote setting. This is followed by the Advanced Specialised Training component, which is a further 12 months full-time discipline training, as specified by the college. For example, in Aboriginal and Torres Strait Islander health, academic practice, adult internal medicine, anaesthetics, emergency medicine, mental health, obstetrics and gynecology, paediatrics, population health, remote medicine, or surgery. The entry requirements for general practice training include having general medical registration, completion of PGY1, and having citizenship or permanent residency in Australia. When applying, trainees have the choice of 2 college training pathways, either ACRRM or RACGP, or trainees may choose to train with both colleges. Trainees can apply to undertake Australian general practice training through these colleges anytime from PGY1. Applications for entry to the AGPT program usually open in late March and close in late April for entry in the following year. Applicants will need to submit an online application through their preferred colleges, including supporting documents, referee details, and training region preferences.
If I was to ask the 20-year-old me what I would like for the future, I think what I would like is the future that is now. To be able to enter with great support, a training program that would satisfy my need for academic rigour, give me opportunities to do teaching and research, as well as still stay very sharp at the clinical edge, because I was having great exposure and great mentorship. And I think that's what the regional and the rural areas offer. Those of us who have come before recognise that there's huge value in supporting and mentoring young doctors, and I think I would like to be part of now. I'm part of it, but I think you guys have a great opportunity.